Diagnosis. I'm your host, Chanel Laurie Wyatt. Today I have joining with me Joy Chandler, RN, and she's also a director of nursing. I also have Tania Lowry Smith, who's a healthcare director, and she's my sister. They're both my sisters. So I want to introduce them and thank them for joining me tonight. First topic of today is podcast importance. Now we have this platform where we can communicate by another means of technology. In your opinion, Joy and Tania, and I don't care who goes first, what is the importance of us having this platform now as far as podcasts, as far as having a healthcare podcast?
I think it's just what you said. We've seen the evolution of nursing and how we care for people, especially since COVID, right? With the really, the birth of and the expansion of telehealth medicine, right? Where healthcare is not just, brick and mortar. We have expanded to reaching people in places that can't get to us.
Nurses Station is a web series now streaming on YouTube that gives a voice to nurses.
The stories that are dramatized are based on actual nursing experiences.
The goal is to show to the public what nurses actually go through and to accurately depict the workforce.
So it's one of the biggest mega trends, honestly, in healthcare right now. And that's been leading since 1990. I want to say, I'm just going to go out on a limb and say that mental health has gotten it went through a whole different phase during COVID-19 in 2019. I'm going to say that without even doing any research. So Joy, on that, a couple facts. It's the leading cause of disability right now worldwide, mental health wise. We both work as directors for the nursing homes. We know I had one building where 80% of my geriatric population was on some type of antipsychotic. 80%. Relationships with AI. This is another thing I want us to discuss as far as mental health, because now technology has evolved in a manner where we're having relationships with artificial intelligence, and it's not considered a mental health crisis. So those things I want to put out there, Joy, and then when you get your thoughts together and tell me what you think about that as far as our mental health investment.
So mental health is just one of those things. It's so taboo, right? When our parents were our age, it was not talked about. It was not acceptable in our societal norms to be, abnormal. It was not common for people to talk about, their need for Xanax or their anxiety or their depression or their battles or their struggles with, schizophrenia or bipolar disorder.
Right.
It may have been treated privately, but it was not a public topic. So now you have this age where we have millennials and Gen Z and the alphas who are just not afraid to talk.
Right.
They're not afraid to tell their story and find people like them, struggling like them.
Correct.
And like you said, I think COVID really opened the door for people to have these honest conversations while suicide rates skyrocketed and did things that we saw a turn in our society, and then we readjusted and redefined some of the definitions of what American society calls normal, right? We had to invent things to keep us going during COVID, those 3 years or 4 years that we were deadlocked and locked in our homes and away from our jobs and isolated from family. We had to do something to entertain ourselves.
Right.
I think as healthcare professionals, the onus is on us to really continue to not be afraid to have those discussions, right? To separate and identify for our patients reality versus delusion, and things that we still in this age consider normal, things that we can treat with medicine, things we can discuss with the therapist, relationships that may be abnormal, in my opinion. I can only speak from my opinion.
Right.
As far as the abnormality of, a relationship with an
because that's a big deal for me. The whole uproar with AIs and artificial intelligence. I actually did a survey at a major hospital organization, Ascension. I'm gonna mention that. And I surveyed doctors, nurse practitioners, nurses, and UAPs. I think only 2 out of 18 responses were like they were for it either way. Didn't matter. One person said something interesting like, oh, well, if that's going to keep them from being a pedophile, then I'm for it. Which was a little different. So I was like, okay. I don't know what to say about that. But if a patient comes to you, or say just some random person, doesn't even have to be a patient, with your expertise, and they say, hey, Joy, I'm in a serious relationship with an AI, a hot bot, that's another term that they use for it. What's your response going to be to that person?
I do have a psych background, and we're taught in psych that people who have psychiatric delusions, right, that's not the space where you want to argue and make your reality their reality, right? I would actually offer, use my connectivity in the healthcare community to advise further, psychiatric intervention beyond my scope. Because it requires that level of intervention to figure out what's going on, because there's something going on. Right. Like I said, I think if I were to define, there's abnormally acceptable, abnormally unacceptable. You mentioned pedophilia. We would agree as a society, abnormally unacceptable. Right? Harming a small child, an underage person, for your benefit, sexual, whatever the nature.
Correct.
Right? Abnormally acceptable means this is an adult person, right? Consensual, who bought a doll or whomever or whatever, maybe online access, and they're having a relationship in their mind or in their home, in the privacy of their home, not affecting anybody but themselves.
Correct.
That to us makes it, in society, abnormally acceptable. It's not harming anybody. Correct. It's not making any situations in society better or worse. It's a personal preference, much like you choosing fruit salad over cereal. But it does require, I think, further conversation to be developed by a professional, in that field.
Absolutely. I agree. I think that's a great answer. All right, we'll be right back. We're going for a commercial break, and we'll continue our conversation with artificial intelligence and what it means to us in this society as far as mental health.
And podcast, the platform of podcast is just another way for people to connect with more of a real life example of their healthcare needs or current issues or current topics, and talk with a live person who may or may not be experiencing the same kind of life things and the same kind of health disparities and health, crises and diagnoses that they're experiencing in their homes. So it's absolutely important, absolutely vital, and it gives a fresh face to another facet of nursing and how we reach people and deliver care. So
absolutely, I love it. Tania, what's your take on it? What's the importance of course, us having this
Well,
platform?
I think we should have a Black podcast to cater to the Black issues in healthcare. I mean, normally, when you're treating textbook-wise, you're not dealing with this population 90% of the time. Most of the time, the experiments are, and I work in a teach hospital, experimenting hospital, and there's tons of trials. And one thing I can tell you is that trials are normally like 80-20. 80% Caucasian, 20% African American or other. So I think that's important. And many people won't ever go to a doctor, but they'll pick up the phone or maybe even tune in to a podcast and say, hey, well, wait a minute. Some of these symptoms are, similar to what I have, or I have some of the characteristics of this, and maybe that would initiate them to go further and maybe receive some health care or seek health care, especially like where we're from in the rural communities. It's so hard to get older people to trust the doctors.
Right.
They have such an issue with that. They don't trust them, and we know our own family members that probably died way too young because they didn't follow through with some of the things that they should have, especially symptoms that, had little small chronic things that turned out to make them, something they shouldn't really die from.
Right.
Die from, or lose a limb because the care, wasn't there because of lack of knowledge. So podcast is pretty interesting. I think it'd be a great initiation to get people to ask questions, hear other issues going on, and probably get them moving to a doctor or a healthcare facility.
Okay. All right. I guess in my response, when I was asked that question, I thought about the communication via the networking platform, of course, and technology, expertise, of course, from the healthcare providers, healthcare workers, including ourselves, as well as credibility. That's another big thing, because here you have all these professionals on this platform. Like right now, we got probably 60 years of experience healthcare-wise alone, just amongst us. So that's something credible. People are like, shit, I'm gonna listen to what she has to say or what they have to say because they're actually out here. So that's pretty much what my response was to that. So I appreciate y'all ladies. Those were great responses. Really good. My other question I wanted to tap on, and I'm gonna take y'all back, maybe not as far back, but as far as your career. So that's counting the first day of nursing school, the first day, your prerequisites, whatever. Of all the texts or books that you've read in your career, which has been the most influential? Now, I can say, for my answer, it's The Immortal Life of Henrietta Lacks. Tiny, I know you know I was going to say that. That's my absolute favorite book. That's by Rebecca Skloot. I think that's how she pronounces her name. And it just pretty much talked about this African-American woman whose cells were pretty much stolen. She had passed on, and her cells were still being experimented. Family didn't have a clue about it, and it was just, amazing. So for those out there who have never heard of it or hadn't read it, it's actually a documentary as well on it. Check it out. It is an amazing